This conference will now be recorded.
All right, folks, good evening. We are going to be, okay, Norma, I'll address that a little bit later. So we are going to be discussing test number 4 first. I'll be doing a short review regarding test number 4, which is 1 week from today, which would be on December 16th, Wednesday, and that's when it'll be available. So you will be reviewing and going over chapters 9 and 10. And so we're looking at the muscular system as well as introduction to neurology and the spinal cord. Okay, so with as you see there, I have up an image of the neuromuscular junction. And so what you need to know is you need to know all of what takes place. So recall that I shared with you, and really for this this test number 4, there's those 6 videos as far as that I've put on each of my videos for lecture. Let me just stop sharing for a moment. Back here. All right, so caller, I'm just putting you on mute so we don't hear that. Okay. Share my screen again. There we go. Okay, folks, so sorry about that. So we're test number 4, chapters 9 and 10. Chapter 9, we're dealing with the muscular system and really the neuromuscular junction. I said to you that there were 3 videos that I shared with you regarding the muscular system, and there are 3 videos that I shared with you regarding the neurology as far as the basic neurology, the introduction for chapter 10. And they were all in my videos that I've shared with you as far as teaching you all. So what I would like you to do would be to please review those within the videos that I've shared on YouTube. And you should know a good amount that there's going to be a lot of information that will be on the test that will be regarding the information on those videos as far as, so what's taking place at the neuromuscular junction, right? What is it, what components are that are really the important structures as well as the physiology of what takes place at the neuromuscular junction in order for contraction, muscular contraction to occur, as well as action potentials for chapter 10, what's going on as far as the resting membrane potential, generation of an action potential, propagation of an action potential, right? So you need to know for chapter 9 what's taking place in order to have a muscle contraction occur. There were 3 videos for that, and I shared and explained and talked to you and went through those, as well as for chapter 10, resting membrane potential, generation, and propagation of action potential. So we really went into detail regarding that in particular. So test number 4, that information is going to be on there. You're also going to have to give me information regarding the structures of, so recall that we started from what are the components of a muscle itself, right? And then, so components as far as what is a myofibril, a muscle fiber, myofilaments, actin and myosin, what are their significance, right? So you should know all this. The sarcoplasmic reticulum, you should know what's taking place as far as what's storage and what's taking place as far as like a cross bridge cycle, what's taking place as far as ATP and the significance of ATP in muscle contraction. What's going on regarding the components that are actually blocking myosin and actin from actually connecting and touching. And then, so what are that? So all of the structure, everything that you've seen on those videos as far as structurally and physiologically, you should know that information. And you should have, remember we talked about writing notes from those videos to help you retain that information. So very important. You should know as far as the sarcomere and the components of a sarcomere. That is very important. What's the significance of acetylcholine esterase? These are terms that you need to know. Tropomyosin and troponin, their components. The different A band, I band, Z disc. Rigor mortis, what's going on as far as that's concerned? Why does that occur? And just again, like I said, all the components of the neuromuscular junction. What's a motor end plate? Fascicles, like I said, muscle fiber, myofibril, myofilaments, all these different structures. I said about the sarcomere. Isotonic and isometric contractions. What is the difference between them? Okay, so that's really for chapter 9. That's the chief components of what I would focus on and look at and review the videos on YouTube, because they contain those videos of the what's important for you for chapter 9. For chapter 10, so for chapter 10, excuse me one moment. All right, folks, so let's look here as far as, so here we have the organization of the nervous system. So you need to know this chart. You need to know what they represent. You need to know what's the somatic nervous system, the autonomic nervous system, what's parasympathetic and sympathetic represent, central nervous system and peripheral nervous system. What do those represent? Okay, so these are the components that you need to be reviewing as far as terms. Neuron anatomy. What are the components of a neuron, right? The dendrites, the axon, the soma, that's the cell body. What's taking place, and we have different terms that we've given you as far as the axoplasm, the axoplasma. So you should know that, axolemma, sorry. Also the types of neurons as far as multipolar neuron, right? And bipolar neuron, right? Those, you should know those terms and what they represent. As far as the different types of support cells, recall that we talked about in this sympathetic, in the parasympathetic, no, in the peripheral nervous system, sorry. We talked about that there were satellite cells, right? And there were also Schwann cells. But then in the central nervous system, we have other types of cells. We have 4 of them. So you should know those, and you should know where they are, what they represent, okay? We talked about disorders like Guillain-Barré, talked about multiple sclerosis, what happens in those disorders, and how does that affect the function for the patient of the nervous system. You should know really the basis of what's taking place with an action potential. So the resting membrane potential, depolarization, repolarization, hyperpolarization, then return back to the resting membrane potential. You should know regarding absolute and relative refractory periods. You should also know, recall that at the end of the chapter 10, spinal cord anatomy. So spinal cord anatomy is very important as far as knowing the structure, knowing what types of nerves they are, right? So we talked about mixed nerves. We talked about whether they're motor, sensory, or both, and spinal nerves are both, right? They carry fibers as far as in the dorsal and the ventral regions. You should know that information, right? You should know as far as white matter and gray matter, what does that represent? You should know the basic components of the reflex arc, okay? As well as for the stretch and the withdrawal reflex. How does that correlate, and what are they in regarding? Okay, so review those in particular, okay? And let's see. And so you should also, like I said, spinal cord anatomy as far as the cauda equina and other, the conus medullaris, right? You should know these terms. Well, what do they represent? Okay. All right. So as far as that's chapter 9 and chapter 10 for you all. Okay. So if you have any questions, reach out, send me an email, not a problem, and I'll help you any way I can. Okay. So I'm going to stop sharing for a moment and just see as far as questions there. Okay. Okay, Uros, I don't know what you said as far as what occurs. What is that in regarding your question? Go ahead.
Oh yeah. So I don't know. You said something. This was occurring, so I just missed that word. So I just wrote. Thank you.
Okay, you can review it in the video for sure. Okay.
Yes.
All right,
Thank
folks. So very good. All right, so I'm going to stop sharing. I'm going to hide everyone and start sharing again and get into and finish up chapter 11 for us all. Okay? And what we're going to do first is just review of the notes a bit. All right, so we talked about, and we mentioned this regarding the spinal cord, as well as the central, as well as the brain, the meninges, the coverings of the central nervous system. Okay, we talked about not only do we have these connective tissue coverings, but we also have these spaces, whether they're outside of the covering or beneath, below the covering, and between two other coverings. So in the case of the dura, the arachnoid, and the pia being the one that will have, the covering will have direct contact with the neurological structure. And then you'll see the spaces in between and what's located. So you should know what's taking place as far as if a patient is given an epidural, where is that going to be that medication administered? If a patient suffers from a subdural hematoma, what's going to happen with that? And I shared an image with you also in documents and resources. The subarachnoid space as far as the location for the cerebral spinal fluid. And then we talked about the ependymal cells in particular, right? As well as working with the choroid plexus to produce cerebral spinal fluid. We discussed the ventricles because this is where the spaces within the brain where we have these CSF is being produced, those choroid plexuses are located, and knowing exactly where they are and how they're connected, important, please. We talked about hydrocephalus. I showed you an image of that. I discussed with you as far as brain plasticity regarding Rasmussen's syndrome and a patient having seizures that the medication cannot control. And so a young patient is actually had removal of one of the cerebral hemispheres in order to help with and to stop these seizures from Rasmussen syndrome. So we mentioned about plasticity, the ability to learn, and at a younger age, very important. As we get older, a little bit more difficult indeed. The cerebral hemispheres. So let's discuss this and talk about this. I did mention to you when we were talking about the spinal cord anatomy, I said to you that the location of white matter and gray matter is different in comparison to the brain. For the brain, primarily it's the cerebral cortex would be the gray matter, and the white matter would be the inner portion of the tissue. But there's also going to be sections of or areas of the white matter and deep within the cerebral hemispheres where pockets of gray matter, and we call them basal nuclei. Okay, these are sections or areas of gray matter. We talked about the corpus callosum and the connection between the cerebral hemispheres and allowing for crossing over of information from one cerebral hemisphere to the other, and also allowing for the right side of the brain, the cerebral hemisphere, to control the left side of the body, left cerebral hemisphere to control the right side of the body. And the lobes, I showed you images of, and we'll review those in a few minutes there, looking at the PowerPoint. And you'll see as far as you should know different lobes, what's primarily taking place within each lobe. And then also we talked about the insula, the insular lobe. And I showed you how that's deep within, and I talked about addiction, that correlation. We also talked about a gyrus and a sulcus. Remember, we talked about that. And a fissure would be a deep groove. So a gyrus is a fold in the cerebral cortex. An indentation would be more of a sulcus, and a deep indentation, a deep groove, this would be a fissure. Okay, so those terms we talked about as far as the specialized areas of the cerebrum. We began talking about this, and I've mentioned this in lab because I showed you that where we have the central sulcus, anterior to that would be frontal lobe. Posterior to the central sulcus would be parietal lobe. And then that first gyrus that's present there would be the primary motor cortex, would be anterior to, it would be the precentral gyrus, is that anterior to the central sulcus, that would be the primary motor cortex. And then posterior to the central sulcus would be the primary somatosensory cortex. So sensory input, pain, temperature, light, touch, these are all present within the parietal lobe. This is where sensory information is going to go to be processed. Now, first though, it's going to pass through the thalamus. So the thalamus is an important structure present within the third ventricle that sensory input is going to pass through. It's like a relay center, and then it's going to go to that primary somatic sensory area, the post-central gyrus. Now know that there's an exception to this, and this would be the sense of olfaction, right? Olfactory nerve, we talked about cranial nerves last class there, and olfactory is the cranial nerve number 1. It's your sense of smell, okay? So that does not pass through the thalamus, Okay, just know that. That's the only sense really as far as sensory input that does not, it bypasses the thalamus for sensory input. As far as speech is concerned, so when we talk about Broca's and Wernicke's area, when we talk about Broca's area, which is more in the frontal lobe, we're talking about that's really the motor speech, okay? And usually primarily more left hemisphere than right hemisphere, okay? Whereas Wernicke's area, we're talking about it's more posterior and in more like parietal region, and really close to parietal and temporal lobe, and we're talking about understanding speech, language development, that kind of a thing. So knowing the difference between those two areas, Broca's and Wernicke's, is important. Gustation. Gustation is your sense of taste. And so the gustatory cortex, frontal lobe, and the insula, right? And so we'll talk about special senses next semester in AMP2. So the blood-brain barrier, do you recall in when we talked about the support cells, right, for the central nervous system, we talked about astrocytes, right? So astrocytes help to maintain this blood-brain barrier. So water-soluble items like water, glucose, essential amino acids, right, these will pass through this blood-brain barrier. But items that won't pass through the blood-brain barrier would be metabolic waste, most drugs, non-essential amino acids, potassium ions. These can cause issues within the brain, and so the brain, the astrocytes set up this, really this barrier that prevents passage of these items from entering into the brain and cerebral spinal fluid. Also, protection regarding any type of issues that can move from, so bacteria, viruses that can move from the blood to the brain. That's what the blood-brain barrier is there for. And again, astrocytes. And know that also microglial cells are very important for as far as an immune function for the brain and protection. I believe that we talked about this last class as far as, but I'll just review it there as far as concussion, contusion, cerebral edema. So we start from slight brain injury to major brain injury that can compress and kill the brain tissue. Know that any type of injury can be cumulative. So even though concussions are maybe considered more of a slighter brain injury, there still can be cumulative over time and cause brain damage. So maybe no permanent brain damage initially, but cumulative concussions can, successive concussions can have a cumulative effect and cause brain damage. The CVA, also known as AKA a stroke, right? You have a ruptured blood vessel supplying a region of the brain, and so know that any area that is distal to the area of the blockage or the rupture, this can allow for then death of the tissue. Okay, terms like hemiplegia and aphasia, very important for you to have an understanding and knowing that as far as one-sided paralysis. Right, so if you see someone who is having issues moving one side of their body, if it's the right side, it's usually the left side of the brain that has been affected, and vice versa. As far as aphasia is concerned, so this is where we have damage to the actual control of the speech. So we're talking more Broca's than we would be Wernicke's, but it can be a combination of both of them. A transient ischemic attack, or a TIA, or a mini stroke. Have you ever heard of that? Here we have temporary brain ischemia. Restriction of blood flow, and so this is a precursor to a CVA. And so if a patient is experiencing these TIAs, it's letting the physicians know that as far as in the future, this patient is absolutely at a higher risk for a CVA. An aneurysm, so I believe that I might have mentioned this to you, maybe not though, maybe it's more A and P2. An aneurysm is when we have a dilation of an artery. It's a matter of an expansion. Have you ever blown up a balloon and had a little bit of a defect in the balloon where it's kind of like a bubble on the balloon itself? This is not good. So we can actually have the connective tissue and the artery itself, which is a very sturdy, strong blood vessel, much stronger than a vein because there's more pressure passing through and more resistance given by the artery to blood. This is not a good thing. And if there's a rupture of, say, the abdominal aorta, right? The abdominal aorta is close to the spine and more in the posterior aspect of the abdominal pelvic region. This can be, well, really abdominal region. This is a large blood vessel under high pressure, and if this actually ruptures, this can be a catastrophic event where the patient can die as a result. I don't know the percentage, but it's a very high percentage as far as mortality for this. Alzheimer's disease and Alzheimer's disease and other types of dementia, right? They are progressive, they're degenerative. Patients do not get well as a result of suffering from these illnesses. They just slowly progress. Now, some can progress quicker than others. Truly, disease and disorders are very much like that depending upon multiple factors other than just, yeah, you and I both have the same disease and we're going to really experience the disease the same way. That's not the case with dementia or any other illness, truly. You'll see here as far as abnormal protein deposits, and really it's an issue with removal of waste. Have you ever known this? Think about this for a moment. You stayed up pretty late one night and maybe did an all-nighter for whatever reason. Maybe you worked, maybe you just were out hanging out and having fun with your friends, and you didn't get much sleep, if any at all. The next day, so say you get an hour or two sleep, you wake up, or you say you get like 3 hours, 4 hours of sleep, you wake up. How do you feel? You don't feel so good, right? Because what's going on is that you've not given your body the time to repair what's going on and to really perform its maintenance functions as far as cleaning up of different types of waste products. Okay, and as such, this can have, and what they've been trying to research and develop is that, are there cumulative effects of having issues with the lack of good proper sleep and the lack of removal of waste products each day? And so can that build up within the brain? And so there's been research that has said that that is the case. So, and they're still working on trying to figure things out with that as far as there's talk of what's called the glymphatic system. And I can share that link with you all as far as I think you'll find that pretty fascinating. So memory loss, irritability, confusion, and ultimately hallucinations and death. So Alzheimer's disease is not a diagnosis that we would want for any of our patients, let alone our family members. It is a progressive disorder and chronic. So as far as migraines are concerned, so migraines, many patients suffer from all different types of headache presentations, and migraine is one of them, and it's more of one of the severe types of headaches and challenging to treat, to be honest. Patients can have very similar types of presentations with the headaches, and yet some respond to certain medications and some don't, and other types of treatment. And in my career as a doctor of chiropractic, we also worked with many patients adjusting the cervical spine and affecting the musculoskeletal issues with the cervical and thoracic regions that can contribute to and exacerbate migraines and other types of headaches. Okay, so this term, the diencephalon refers to structures that are deep within the brain. Okay, so the thalamus, the hypothalamus, the epithalamus, and the pineal gland, or aka the pineal body. Okay, major relay and processing center for information to and from the cerebrum. Right, and so know that thalamus. We showed you the thalamus in the lab as far as in the sagittal head model. We looked at where it's located in the third ventricle, and really, as far as components are concerned, the thalamus is one of the largest areas there. And even when you look at it in the lab, seeing the difference between the thalamus and the hypothalamus is nowhere near as large as the thalamus as far as taking up surface area within the third ventricle. I said to you that it's the sensory relay center. I said to you that sense of olfaction, the sense of smell, does not relay here. Okay, so very important to know. Interesting also that there are these nuclei. So nuclei present within the in the central nervous system, okay, in the brain. These are cell bodies, so neuron cell bodies. So this would be gray matter present deep within the central nervous system. Okay, cell bodies for hearing, vision, taste. So special sense neuron cell bodies present within the thalamus. The hypothalamus. We'll be discussing the hypothalamus throughout next semester. There, very important as far as its very intimate contact with and control of the autonomic nervous system, okay, working with the endocrine system. So we'll be talking about the endocrine system and the production of hormones and what takes place as far as their who's producing what and what type of action these chemical messengers do, and their where they're specifically going to as far as the specific receptors throughout the body. So we'll be discussing that next semester. But know that the hypothalamus controls really what happens with the pituitary gland. So we would say that the pituitary gland would be the master gland, but the hypothalamus is the master controller of the autonomic nervous system, because that pituitary gland is the master gland working within the endocrine system and really with the autonomic nervous system. Very important how both systems work together. You'll see here as far as also for the hypothalamus, temperature regulatory center. Helps to work with the medulla oblongata and the pons as far as for these very important issues as far as heart rate, blood pressure, respiratory rate, working in conjunction with medulla and the pons. Now, in particular, as far as these are concerned, the medulla oblongata, primary control over heart rate, blood pressure, respiratory rate. The pons works in conjunction with the medulla as well as the hypothalamus. Okay. Now, this is interesting as far as recall, I showed you in the lab there, posterior to the pituitary gland would be the mammillary bodies. They were kind of deep and below the third ventricle. And you'll see here as far as those bumps, right, on the posterior aspect of the hypothalamus, inferior to and posterior to, also the pituitary gland, memory and emotional responses to odors, okay? So this is quite important too, that the hypothalamus is also has an important role and part of what's called the limbic system. The limbic system is like the emotional brain. And so what I would tell you is that, have you ever had an odor that you smell and you're like, oh, that reminds me of Christmas, or when I was a little kid and mom would make me a birthday cake, or something like very positive, right? Or like smelling apple pie. Doesn't that give you like a good positive and good memories and good emotions for the most part? How about something like a skunk? You smell a skunk and you're like, oof, that's terrible, or a dirty diaper, right? That's I've had experience with that now, but this kind of doesn't give you the same positive. Gives you more of a negative, and it's not only just like oh, that smells bad. It's like, oh, that smells bad, right? So like there's this emotional response. There's mammillary bodies are involved in that, okay, as well as the hypothalamus working in conjunction with the epithalamus. So I didn't mention to you the epithalamus, but know that it's the roof of the third ventricle. So the roof of the third ventricle is considered the epithalamus, okay? And what would that be? That would be really the superior aspect of the thalamus contained within the third ventricle. And then the pineal gland, aka the pineal body, produces melatonin. Melatonin is something that it's not melanin, right? Melanin would be a pigment, integumentary system, for your iris, for your hair, these where there's color as far as for the skin, right? Melanin. Melatonin is a hormone produced by the pineal gland, and this really is synthesized and kicked out as it starts getting dark outside. The body, your visual input sees that, and the body knows that, hey, okay, so now it should be time for cooling down, for calming down, and getting ready to go to sleep. So it induces sleep, and so really this circadian rhythm. This is the biological clock that many of us mess around with when we work the night shift. I've done the night shift many years ago when I was a much younger man, and it's really working the night shift is tough. It's tough on the body. Those of you that are pursuing nursing as a career, right? So that might be an issue for you, that you might do the night shift, and some people seem to do well. I would tell you that if you do work like a type of shift like that, you should make sure that you're getting proper sleep. Yeah, okay, see, so Jen and Jasmine talking about that. Yeah, so there's a lot of issues as far as patients with issues with depression and such. So SAD, seasonal affect disorder, right? Wow, 7 years on night shift. That's tough. I did a couple years on night shift, and that was just brutal for me. And I would tell you this, that I never craved anything more in my life than sleep. Really, like it was, it was, uh, it was like you craved a drug when you didn't get enough sleep. It's just crazy stuff. I recall taking my dinner break at night around like 3:30, 4 o'clock or so, and laying on the table in the area where you could, the break room, and I didn't care that there was nothing on the table, flat table, just like, oh, it was just ridiculous to take a 20-minute nap. It's crazy. But you do need to make sure, folks, that you're getting proper sleep, because they do say that, and there are studies that show that if you're not getting proper sleep, right? So you can't just take away from that a bit, that need for sleep. I talked to you about the issues with Alzheimer's and other types of dementia. We need to have the ability for the body to repair and do its maintenance duties and remove waste products and such for you to do better. Okay, and you're talking about, yes, I understood, Norma, as far as issues with when, and so like in other countries like Scandinavian countries also, as well as Alaska, where they have times of just night and times of just day, and like the periods where they're either longer or shorter. Yeah, that really does mess up the circadian rhythm, absolutely. And so for people, when it is real light outside, even when it's like late in the night, in the evening and such, they'll put up heavy blinds and such to block the light so that they can have a good sleep, as far as, even though outside it's bright as day per se. Yeah, that's an issue. But I mentioned to you that seasonal affect disorder, as far as making sure that you're getting some type of exposure to being outside. I tell you, I kid around with this all the time and say that I believe that the majority of us are vampires. We're never outside in the daylight, and we need that, and it's important. And really, like, proper taking vitamin D on a regular basis, also very important for the function of your body as well as your mental well-being, folks. Yeah, so if you're having issues, you might want to speak to your primary care provider, your physicians, and talk about supplementation. Very easy, and can really make a difference. As far as the basal ganglia, aka the basal nuclei, this is gray matter lateral to the thalamus, and this really works as far as with the substantia nigra, and really there's issues with these areas regarding Parkinson's disease. Okay, so the basal ganglia will suppress unwanted movement, regulate muscle tone, aids in short-term memory. Now, in the case of then the patients with Parkinson's disease, what's going to happen is that, and know that, so we see here as far as substantia nigra, this is another dark nuclei, right? The terms that you see there are used for representing what we have here as far as large dark nuclei, also in quite close vicinity with the basal nuclei, or aka the basal ganglia. These neurons will inhibit the activity of the basal ganglia. So what goes on, right? And again, the neurotransmitter dopamine is released from the substantia nigra. So you'll see here, as far as Parkinson's is concerned, this is a horrible, terrible illness, folks. And what takes place with this illness, we've seen it in our family as far as relatives that have suffered with this. And we had one of our relatives, actually, sadly, he suffered with it for like 20 years, and he was just really a very sad time with it, and he took his own life as a result. So Parkinson's disease is a very sad illness, and really can really be devastating. Thank you. So damage to the substantia nigra leads to a decrease in. So we said there, the substantia nigra is kicking out dopamine, right? Damage to the substantia nigra as a result of this degenerative disease of Parkinson's can lead to a decrease in dopamine secretion, leads to an increase in the activity of the basal ganglia, because the basal ganglia, they should be suppressing unwanted movement, right? So it leads to an increase in muscle tone. And what happens also is that they'll have these tremors, folks. I don't know if you've seen patients that will have these different types of tremors, and it's really quite sad. And you'll see that they have an anterior antalgia, anterior leaning, right, with the whole body, with the from the waist, from the waist superiorward, and they'll also just like shuffle when they move. There's a rigid gait. There's really very little movement. There's a this blank affect to the face where there's not a whole lot of ability to have much of a facial expression, and it's just Parkinson's. And you've seen Michael J. Fox, who has been dealing with Parkinson's disease for many years. Okay, they'll have different treatments. They'll have medication like L-Dopa, which can help in the beginning, but as time goes on, it doesn't make much of a difference. You'll see here, L-Dopa, approximately 5 to 10% is able to cross the blood-brain barrier. Wow, that's quite remarkable, right? So, and there's also muscle stimulators that they can, or neurological stimulators that they can implant into the brain in order to help with the effects of Parkinson's disease. But again, too, over a period of time, even they don't make a difference in how the patient does what they do as far as their function is concerned. So Parkinson's, yeah, it's a tragic illness. Yeah, the electrical stimulators there. I said to you that the limbic system would be considered your emotional brain. Okay, so when we think of it's more of a, when I talk about, so for example, I talk about the muscular system. That's an actual body system. But if I talk about the immune system is more of a combination of the cardiovascular as well as the lymphatic system working together, right? So the limbic system is not a specific system per se, other than that it's more of a functional system. So we consider it this emotional brain. So your emotions, memory, mood, behavior, olfaction, quite interesting how like that sense of smell really can have a correlation with memories in your life and how it can bring back. I've had smells that have brought me back to memories of being in kindergarten. It's crazy, right? But this is just, so long-term memory can be associated with this. Excuse me. So you'll see here, as far as you recognize these structures, you did not see the hippocampus or the amygdala in the lab as far as looking at structures on the sagittal head, but you did view cingulate gyrus, you did view the hypothalamus, and you did view the olfactory bulbs. Okay, so cingulate gyrus, just if you realize where it's located, then you realize that, well, what's inferior to it? And inferior to it, again, the fornix, good, very good. Yep, so you know what's inferior to it, and so you realize that those structures are going to have some type of role with what's taking place between the thalamus and the what's taking place as far as the post-central gyrus, right? So adding emotional content to the memories that you're experiencing. Again, the emotional brain limbic system, and the hypothalamus, the controller of the autonomic nervous system, having intimate really experience with and function with the other structures that are surrounding it, as far as the hippocampus for long-term memory and creation of new memories. As far as the amygdala, thinking fear and your response as far as to issues as far as having the ability to identify dangerous situations. I've watched some interesting videos regarding Navy SEALs and their training, and how the amygdala really has a very overpowering effect. When you're afraid and you have fear, fear really can just take control of your body and really affect how you would logically handle a situation. So understand this, that when you, if you're pursuing the medical field and pursuing nursing, and you could quite possibly be working in the emergency room. I've had a friend who spent over 35 years as a nurse in the emergency room. And she's quite an interesting woman, and I really enjoyed talking with her over the years about certain situations and issues that she's come up with in the emergency room. Well, someone who works in the emergency room, right, or works in protocol of working on helicopters and going to sites where there's a traumatic injury and having to take the patient and do treatment right there in the helicopter on the way to the hospital to keep them alive. These are situations where, and really I would say in all types of medical fields, we cannot allow ourselves to allow fear to take control. We have to be in control of our emotions. We have to be in control of what's taking place so that we can help our patients and prevent them from having from dying, folks. It could be that severe, right? So we really have to be to learn. That's like a learned behavior. And so practicing what you do, right, over many times, practicing it over and over and over, that repetition will help the different types of tasks that we do and the job that we do. It'll be like second nature to us. So it's really important that we practice what we do. We are involved in not only just a situation where we have to be cognitively thinking about and critically thinking about what's going on with our patient and what can we do to help them, but also it's an action. We have to actually actively do things in order to make a difference and save lives. So very important. And you'll see here the fornix there as far as connecting the limbic system together, right? All right, so the brainstem. I mentioned to you the importance of the medulla oblongata, right? Really, that heart and respiratory rates, blood pressure, medulla oblongata. The pons, this area of the brainstem, works in conjunction with. Recall the midbrain. The midbrain we were looking at, and let's move down here, right? The peduncles, the corpora quadrigemina. This is interesting in that the superior and inferior corpora quadrigemina, the four areas here, four regions of that area, control eye and head response in response to visual stimuli, or like if you hear something. So if you hear something, oh, I turn to the area where I hear that noise, corpora quadrigemina. Okay? Let's see here, the peduncles, really, if you think about it there, what's going on there? That's the midbrain. So we're going to have ascending and descending fibers passing through that region of the midbrain. And we talked about the substantia nigra. The medulla oblongata also very important. Usually when I'm in class and I'm mentioning this as far as, the importance of, so patient takes over-the-counter medication, whether they be analgesics, whether they be cough medicine, they can purchase it right over, right in the CVS and any of the pharmacies, and it's not a big deal. They don't need a prescription for it, right? Yet know that these medications can have a devastating effect on the kidneys and the liver, as well as on the medulla oblongata. So taken for instance, so your center for cardiac center, we know this, right? Heart rate, force of contraction, blood pressure, as far as vasomotor center is concerned, respiratory center. These are all located within the medulla oblongata, vitally important, right, for life. Know that when you're taking cough medicine, it's not affecting really what's going on in the pharynx, in the throat, right? It's really affecting the medulla oblongata to prevent you from coughing. And so if you take too much of a cough medicine, well, if a little is good, more is better. No, that's not the case, but what patients can think, right? And so know that this can be very bad as far as this can lead to issues as far as depressing the desire to breathe. Holy cow, by affecting, sedating the medulla oblongata by taking cough medicine. And then people will take cough medicine with alcohol and mix that together to cause a high. Yikes, that's pretty crazy stuff. The cerebellum. So the cerebellum, we know this is it's quite a large region in the posterior and inferior aspect of the brain, right? In the occipital region, as far as the skull is concerned, right? And inferior to the occipital lobe, posterior to the brainstem. The arbor vitae is the white matter, right? That tree of life that you see there. 10% of the volume of the brain, yet 50% of the brain's neurons present within the cerebellum. Very important area there. Not only just for your balance and equilibrium, working in conjunction with the inner ear, but also, folks, many other important components as far as coordination of movements, right? Yes. Balance and equilibrium, yes. Timekeeper area, prediction of movement of objects as a result of you watching and observing something. distinguishing pitch, no sounding words, planning and scheduling tasks, cognition, and in conjunction with the frontal lobe, the cerebellum helps with this aspect of your brain's ability to think and critically think. Interesting here as far as ataxia, this would be an disturbance in the balance and equilibrium aspect, your gait, your ability to walk. Temporarily, drugs, alcohol, right? This is why they ask a person to walk a straight line. If they have overindulged in alcohol, this can cause a temporary damage to the brain and to the cerebellum in particular, affecting their ability to be upright and to walk correctly and even to operate a vehicle, folks, right? And please don't drink and drive, folks. That is just horrendous. Permanent areas to this can be as a result of trauma, as a result of stroke, can lead to ataxia. And the cranial nerves we reviewed already. So if you have any questions regarding them, I wanted to share with you and show you that I did post, let's see here. I did post for you all. You'll see here as far as, this is a good chart because it gives you the sensory motor of both, as well as the names and the numbers, as well as, or this would also be a mnemonic to help you to know them. And this one right here also for having you figure that out. So, you know, whatever you use as far as mnemonics are concerned, I highly recommend that you rewrite this information over and over in order to get it. And to know that when I do test you on the final exam, I'm going to ask you clinical situations where you'll have to critically think as far as, well, if a patient presents with this, which cranial nerve quite possibly could be affected? Okay, so very important to review that and go over that. Here, as far as our PowerPoint is concerned, so again, too, this is only one half of the PowerPoint for this semester, and the other half will be second semester. But again, we've talked about as far as, so a gyrus, a sulcus, right? So here we would have the central sulcus, precentral gyrus, postcentral gyrus, somatosensory cortex right here, primary motor cortex here. There's also going to be motor association areas here. For the occipital lobe, we're looking at for your visual cortex, temporal lobe for your auditory cortex. Parietal lobe, I again said, for more sensory input. Here we have the midbrain, the medulla oblongata, right? Cerebellum. Here you're seeing as far as the presentation of white and gray matter. Again, for chapter 10, we saw the presentation of gray matter and white matter present within the spinal cord, and it's opposite of what's the presentation within the brain. So you see here that the gray matter is the external area, the white matter is the internal, yet there are areas internally that there are these basal ganglia, these basal nuclei where there are gray matter. There are areas of neuron cell bodies present. Remember, white matter represents myelinated regions of the brain. And again, here we have, as far as for talking about, showing you just the different areas and what's associated with those different areas as far as function is concerned. And the cranial nerves.